Riveting content, empowering your life. Welcome to the Sphere. This episode is sponsored by
Dr. Taraya M. Richmond, PLLC. When it comes to your family's health and women's services, and you're looking for excellence in healthcare, look no further than your family medicine physician, Dr. Taraya M. Richmond, PLLC. Call Dr. Richmond today at 713-453-6962 to schedule your next appointment.
Looking to advertise? Join the Sphere's vast demographic reach of thousands of people all over the world. Send an email today to advertise@thesphere.tv or call us at area code 832-772-7789. KOG and Company. Are your unique gifts and talents changing the world? Do you desire to belong to a community of unity? Visit KOGpassion.com to learn more about the Unleash Your Dopeness movement.
Well, hello everyone, and welcome back to Docs. I am Dr. Simone Ellis, and I'm excited to be back in the building today. Of course, my lovely co-host is just had a baby, so you'll see her back in the studios in the next coming weeks. But you guys got me here today, all exclusive to you guys. So, of course, you can find me at Smile Design Studios. I'm located on Highway 6 and 1092 in Missouri City, Texas, at Smile Design Studios for all your dental needs. And I'm excited to be here today on this cold weather in Houston. We had snow. Everybody's out there making snowmans that last literally for like 5 seconds. But I'm excited because I have one of my good friends, colleagues, and Xavierites here in the studio today. Dr. Ngoddy, how are you doing today?
I'm good. How are you?
I'm wonderful. So for everyone, of course, I love all my Xavierites, but it's especially exciting to see a woman entrepreneur do her thing. So I want you to tell a little bit about who you are, where we can find you, and how you got into all things eyes, or all eyes on you, right? So tell us a little bit about
everything. It's kind of like all black everything. It's a little...
Love it. So let's share some of your black girl magic. Tell us about yourself. How did you get into eyes, and where did you even go to school at?
Good. All right, Simone, first of all, I want to thank you for inviting me to be on your program.
Aww.
So this is exciting. This is a great platform to share things about eyes. We don't get enough shine.
Y'all don't get enough shine.
We don't get enough shine. But yeah, I am a graduate of Xavier, as you stated. I graduated from there in 2007. So we just had our 10-year reunion, and I also ran into you at homecoming. So that was good.
Didn't we have a great time? You looked fabulous.
Thank you.
I don't know if I was sober or not, but hey, we won't talk about that for this show.
We were there. That's all.
So your 10-year reunion, that's huge. I didn't know you were 2 years behind me. I thought that you guys were a little bit closer, but you guys look beautiful.
Huh? Oh, thank you. Thank you. You always say that, but yeah, we were 2 years behind.
I really want you to be like right next to me. I'm like, I'm trying to keep you in the pocket. So.
No. So I went to Xavier, and I'm an Atlanta native, and then I graduated from Xavier, and then after Xavier, I took a year off, and we'll talk about that. And then I ended up in Philadelphia at Pennsylvania College of Optometry at Salus University, and that's where I graduated. I graduated from there in 2012.
Okay.
And then after that, I did a 1-year residency, an ocular disease residency at Omni Eye Services of Atlanta. And that was through the University of Alabama. So I completed that in 2013.
So you got just degrees upon degrees. I'm so proud of you. I mean, seriously.
Thank you, though. I appreciate that.
So what made you get into eyes? I mean, because that... for me, when I did gross anatomy in school, I was like, it's in the soul of a person. Like people with eyes, it's just like you see into everything. I feel like it gives people life. And so it freaks me out. I'm not going to lie. Like eyes really freak me out. So how did you even get into that?
To be honest, so you know how Xavier is, and for those of you who don't know, the Xavier is known for getting African Americans into the health professional programs, and
We're like
so
number one. Like, let's give us
well,
credit. Like,
yeah, well,
we're the best.
there's that.
We're the best. So,
So when I went there with the intention to be a doctor and went through the classes and everything, and I did pretty good. But then what happened was the MCAT took that. That didn't go that great. So after that, I was like, "Whew, what am I going to do?" As most of my classmates did pretty okay. I mean, there was a spectrum, and
right.
people we were all applying and everything, and I still applied even though they told me not to apply. I knew I wasn't going to get in.
Yeah.
And so as graduation was approaching, I was actually riding down St. Charles with one of my line sisters, and we pulled into the Wendy's, and my line sister Tiffany, and I was just telling her, girl, I don't know what I'm going to do next year because I knew I was graduating and I knew I didn't get into any programs. And she said, Maka, you just need to do optometry. She's like, it's non invasive. You'll still have patients. You'll be a primary care provider. It's not going to be a lot of blood. And then you'll also have a good lifestyle and things like that. And I was like, oh, that sounds cool. So I started doing my research, and I have Nigerian parents, and when I told
So I was gonna go into that. Like, I was trying to like get a pause in there. So like, how did that go over for you as a Nigerian?
I told my dad.
The MCAT was like, I could just hear Daddy popping off in the background. Like, you didn't pass the MCAT. What's going on?
No, my parents are actually really cool. They're very supportive. They're very supportive of everything we want to do, but they like to see us try. So because I had said I wanted to be a doctor for so long, and that had a certain look to it, when I brought this to them, I had to bring it almost in a PowerPoint presentation and just
wow.
let them know. Because my dad was like, so you're going to be working at Walmart? And I'm like, kind of, maybe. I don't know yet.
You're still Ngoddy equals doctor. Like, it's still going to be doctor, right?
A doctor, but these are the opportunities. So, and the research that I did for them was also for myself, because I grew up going to, I won't say where I went for my exams. And so I didn't have a lot of background in full eye exams. And the first time I actually got dilated was when I was in school. So
okay.
I didn't have a lot of background. So when I did that research, it just opened up a whole new world for me. And so I actually ended up applying to optometry school and reapplying to med school, got waitlisted for med school, and was like, let me just go on and go into optometry. And I went to the summer program that the school had, and it was good, and stepped in the clinic, and I got a good vibe, and I liked the pace and things like that. And so I was like, okay, I'm gonna do this. And so I started optometry school 2008, fall of 2008.
Well, I have to tell you, I'm super proud of you, because a lot of times people will take that MCAT and get defeated that they're not getting into med school. But what you did was you took something and said, hey, I'm going to make something different from this, and still have been uber successful. I mean, now you own 2 shops. I mean, like, let's talk about that entrepreneur. I love it. Where could if I'm in Atlanta and I need to get my eyes taken care of, where am I going to go to find you?
So that's cool. So I'm glad you asked me about that, because it is something that I'm proud of. With optometry, you do have the opportunity to be a business owner with relatively, I don't want to use the word ease. I don't want to say it's easy, but there's a lot of opportunity to be your own business owner. So essentially what it is that I'm an independent contractor.
Okay.
And I lease space from 2 different retail locations. So I have a Sam's Club location, which is located in Morrow, Georgia, off of Jonesboro Road.
Okay.
And then I have a Walmart location, which is located in East Point, off of Cleveland Avenue.
Okay. So, and how has it been being an entrepreneur? I mean, from one entrepreneur to another, I know that can be a lot of positives and negatives to that. How has that been owning, your 2 locations?
Yeah, a lot of ups and downs, Simone, which anybody who owns a business will tell you about staffing and payroll and this and that, because they don't teach you that.
They do
school.
not.
These are the things that we're learning at these continuing education classes,
right,
where I probably sit in the back and scroll Instagram the whole time. But no, seriously, it's very difficult to kind of learn the things that they don't teach you in school. But luckily, my parents both own businesses, so I got some of that grounding, some of that thick skin when it comes to dealing, with employees or learning how to incentivize people and motivate people to, be able to do a good job. So that has been a little bit of a challenge, but then also the reward of getting up every day or working for yourself. And I do work a lot, but being able to have that pride in what you're doing, and also I pride myself on trying to provide people with eye exams that they'll remember or memorable experiences, because most people are coming to the eye doctor, and most people need glasses and contacts. And so how do you make that experience memorable? How do you make that experience one where the person feels like their family? My family has owned a daycare center for over 20 something years. And so even when I was thinking about dual medicine, I wanted to do a family practice type of thing because I wanted to be involved with families.
Wow.
It's what I'm used to. Most of the rest of a lot of my family is in education. And when you're in education, you're involved with families because you're at the schools and all the kids come through. And that's how it was with the daycare. So I wanted to be involved with families. And so ironically, actually, my Jonesboro or my Morrow practice is not too far from my mom's daycare. So I run into some of her staff, and I run into old parents and the old people that I used to know. So
oh my God.
It's been a really good experience.
Well, I want to tell you, like, I don't know what the Nigerian culture is doing, but you guys keep doing it. I need to learn something from my future unborn children. I mean, from the entrepreneur standpoint to even motivating you to do so much more outside of college, I'm just really proud of you. And so I'm excited because this topic today for everyone who's tuned in is about eyes, all things eyes, or all eyes on me, or all eyes on anybody else. But for me, I actually have no clue about eye exams at all. So I'm excited because you're going to be teaching me a lot today, and hopefully for the viewers as well. So one of the hot topics, let's get into that, is, of course, your favorite eyelashes, or you used a way to describe it as ocular aesthetics. Is that what we're calling it now?
Right.
So
yeah,
I'm a huge fan of eyelashes. I have a pass to Amazing Lash, and I want them to be longer. But I have a girlfriend who was doing it, and she was having the worst reactions to the eyes, where her eyes were looking like, straight up Satan, the devil. And so she had to take them off, and now she uses, like, where she goes to the MAC counter and just gets the strips. But tell us a little bit about, ocular aesthetics, as you call it. I think that was a nice way to describe it. What's kind of hot right now? What should be okay? What's not? For the people that are also wearing the most tacky looking ones, girl, the ones I call them broomsticks, where you done got some hair glue from your mama's kitchen, and you
fly off into the night.
Yeah, like, why is that even cool? So please, for the lay people, tell us a little bit about these ocular aesthetics and what's acceptable, what's not.
Okay. I'm definitely happy to share that topic because we have been on fleek for the past how many years? I think that's kind of outdated now. I think things are lit a little bit more, but when eyebrows and eyelashes went on fleek, we all went crazy. And so
well, Dr. Ngoddy, before you go into really, really detail, let me do this ad real quick, and then I'm going to let you go in because I'm ready for it, because the fleek is a mess. And so this portion of the show is sponsored by Dr. Taraya Richmond. Find excellence in healthcare is no easy task. When your journey begins, look no further than your local family medical physician, Dr. Taraya Richmond, PLLC. Dr. Richmond offers an array of services, including pap smears, breast exams, STI screenings, contraceptive management, prenatal care, and so much more. Call Dr. Taraya Richmond, PLLC, to schedule your next appointment today at area code 713-453-6962. And I'm so glad I saw this ad because I actually get asked all the time about a primary care physician. And so now I have one to have people go to. So, okay, back onto these fleek eyelashes, Kim Kardashian looking, whatever we got going on. Please tell us about them, what they are, how we should be getting them. Should we even be getting them? And then even eyebrow extensions. That's a big thing too. Microblading, all of this great stuff. Educate me, please, so I know that if I'm going to Amazing Lash Studios, what I should be getting.
Well, this is a fun topic, and I like it because I've been wearing eyelash extensions. I'm telling on myself for probably like 2 years now.
Okay.
And so they're not bad things to. They're definitely not a negative thing or something that is people should avoid. When you talk about ocular aesthetics, that it actually encompasses a lot of different things. It basically is just talking about pretty eyes. People always ask about bags under their eyes, or they ask about puffiness. They ask about their eyes turning colors, or there's a lot of different topics under ocular aesthetics. And to be honest with you, the term I actually heard for the first time a couple of months ago when a friend of mine or a colleague of mine, someone I went to grad school with, he has a podcast, Defocus Media. So I have to definitely shout him out because I don't want to pretend like this is just information that I just had sitting around. It was something I heard and I got really interested because, African American women, we love, women, anybody, people like things that are pretty. They like things that are nice. And so it's a topic that's very relevant. So
yeah, we want to be enhanced. I think that for eyelash extensions for myself, like I look tired all the time. So when I put on eyelash extensions, I feel like I'm just like
makeover.
Oh my God, I put on no makeup because the eyelashes do it for me, right?
Absolutely. So just to go into the eyelash extensions because that is a hot topic. The thing that concerns me the most as an eye doctor is that I often see people and they have, like you said, allergic reactions to the glues, to the adhesives. They have a contact dermatitis, just something. Basically, whenever you put that glue on the lash or put it close to the eye just says, no, I don't like it. I don't want it. So eyelashes are supposed to serve a particular purpose. Part of it is to catch some of the debris from the world. They also shield, your eye and protect your eye. They act as a protective mechanism if something's coming towards your eyes to close your eyes. So they're definitely supposed to be there. So there's nothing wrong with having them. But when they get too long, they can actually cause dry eyes. Or like we said, the issue of the allergies. So I'm kind of talking all over the place, but I want to drive home the point that eyelash extensions are great, but you want to be careful with the glues. And what I tell my patients is to make sure that if they've been going somewhere, make sure that the person keeps using the same products because a change in products could cause that allergic reaction.
Yeah, so do you not know? I guess there's no way for you to know that you're allergic to anything until it's actually applied, right?
And a lot of times it's the second exposure than before the first one, because you built up that antibody to that. So you never really know what's going to happen. But if you've been going somewhere and things are going well, that's good. What I've seen and what I would ask people to tell people to avoid, I've seen where you get the wing effect. A lot of the times what it is that the lash person has adhered a top layer and then stuck one underneath. So you basically are sandwiching your real lashes into this trap, I'm going to call it, because of the experience I had with it.
It looks like oh my God, it's a mess.
They trap the lashes in between those two. They sandwich them in between there. And what I've seen or what I experienced personally was a patient that had a contact dermatitis to the glue or had an allergic reaction to the glue. And then she and I had to sit with tea tree oil and get the lashes off of her eye.
Oh my God.
Quite a bit of time. A lot of makeup remover pads and things like that. And then of course she lost quite a few of her real lashes. So when you're going in, you want to use a person that, is reputable. You want to use a person that has a good technique that actually, if it's it's supposed to be an extension and not just individual lashes, that they're actually extending your eyelash and not putting it on your lash line, different things like that. So you want to ask some questions and you want to look at their previous work and just make sure that they're not doing things like sandwiching your eyelashes in between cement, essentially.
Yeah, I just don't think it's acceptable for these people to use also like hair glue. What is that? Yeah, in my mind, that just doesn't make any sense at all. So, well, thank you for. Yeah, and I don't know if it's like I call it the hood like mentality. I'm like, y'all, come on, we got to do better. So I'm excited to learn a little bit more about eye exams and all these great things. So guys, we're gonna be ending our Facebook Live right now. But if you are interested in this topic, please, we ask that you subscribe to all of our shows on our major platform, including iTunes, SoundCloud, Google Play, and Stitcher. Review our show on iTunes with constructive feedback. We want to hear about this show. We want to hear how you guys feel about it. We want to get some constructive feedback. So please make sure you guys are reviewing our shows. And then, of course, share this on Facebook Live, post the entire show with your family and friends. We're doing something a little different over here. And so we want to make sure that people know about us. And the best way for us to get more traction is for you guys to share this information. And of course, donate to the mission. Of course, you guys can go over to www.thesphere.tv/donate. Each week, we're bringing you guys enriched content and inspiring things, and we want you guys to help us to continue to grow the Sphere. So please go over there and throw some coins over there at thesphere.tv/donate. So guys, be sure to check us out, and we're going to continue having this conversation with Dr. Ngoddy on iTunes or all our other clouds, right? Oh my God. So come on over, guys. So let's go ahead and get into why routine exams are so important for someone like me who does not go to the eye doctor every year. Why is that important? I personally don't wear glasses, right? That doesn't mean that my vision is 20/20, so it just doesn't make a sense to me to go. I don't think about it, but I'm excited because, again, I don't know anything about this. So as somebody who could be potentially your patient, why should I even go for a routine eye exam? Why is that important to get my eyes dilated?
Okay. So you've asked a couple of questions. So the two questions you asked, I think they're a little separate, so we'll kind of address them separately. So the first one you asked was, why is it important to get your eyes examined? And then the second one you asked was, why is it important to get the dilation? So that's the second part. So the first part, with eye exams, we are essentially checking, first for refractive error. We're checking and when I say refractive error, I mean, are you nearsighted or farsighted? And if you could put up the first slide for me that I shared with you, we can kind of talk about that a little bit. Okay. Now, let me ask you, where are people viewing the slides?
So we can see it, so you can just pretend as if it's up for you as well. So we got it up. It's good to go.
All right, perfect. So we are checking for refractive error. That's the basic thing. And I know people say that they're 20/20, but a lot of times they may have a little bit of refractive error or nearsightedness, farsightedness, or astigmatism that may be causing them strain and may be causing them difficulty driving at night or in inclement conditions. Their eyes may actually mask what little prescription that they have, so they don't notice it. But when they get fatigued, they get blurry or they get headaches, and they're trying to strain through that refractive error. So that's the first thing that we often check for, like your vision and what how well you're seeing, but then what prescription you might need that could improve your vision, that would help you relieve some of the strain. So
and how are you checking for that? How are you checking for that? Is that like the typical, like when we're looking at the letters on that on the board, or what's the exam like?
The first part of the exam, we do check your vision, and we check and see how well you're seeing. Are you seeing well at far? Are you seeing well up close? Things like that. And we call that visual acuity.
Okay.
So that's the big E chart, the Snellen chart. What can you see out there? Cover up your left eye, read this, etc. And then there are other instruments that we use throughout the exam to get an estimate of your possible prescription. Plus, if somebody has worn prescription glasses before, we often read those and then just kind of see where they've been, just to see, especially if the person has any complaints, what might be causing those complaints. So once we check your visual acuity, we do use the information that we've gathered, old prescriptions or the auto refraction, often that shows an estimate of your prescription, and we put that into the 4-opter, which is this instrument right here. I know
I've seen that before.
Yeah, when Justin Timberlake made his album.
Yeah, right? Okay, yeah, so I got it. I was like, why have I seen that? And you guys make that thing move real fast, back and forth, right?
We do. And we ask people questions like, which is better, 1 or 2, and we frustrate people because they think that we're tricking them. And sometimes we are, because you want to make the person pick the same thing a couple of times just so you're sure that that's what you want to put into their prescription.
Got it.
But yeah, so what I'm showing you here are some normal eye conditions or conditions that we encounter regularly. And so the normal eye is a particular size. If you're myopic or you're nearsighted, you have a longer eye. And so when light comes into your eye, it bends before it gets to the back of the eye where you can actually see things. Okay. So what the glasses do for a myopic eye or nearsighted eye is they bend the light so that it hits the back of the eye, and you get a clear image on your retina or the wallpaper of your eye, and then you're able to see.
Got you. So for
essentially,
someone,
glasses or contacts, they're refracting surfaces, and they bend the light to put the light where it needs to be for you to see.
So for someone like me who has never really went to the eye doctor, how would I know that something like this is going on with my vision?
You wouldn't really know. It's now people who are blurry, they're blurry, but
Right.
but that's what going to a routine eye exam would unveil for you.
Okay.
Are you straining? Is there a bit of prescription that you're masking that you know, as you continue to have birthdays, you won't be able to mask anymore? If I had to guess, I would say you're probably farsighted because things far away look good to you. But as that means that as you're advancing in your career, you know,
Right.
as you continue to have birthdays, you're going to notice that looking at people smile becomes blurrier quicker. You're a farsighted individual. The things up close to you are going to get blurry to you sooner. So if you go to slide number 2, it kind of shows the difference between a hyperopic eye and a myopic eye, or a farsighted eye and a nearsighted eye. On the top one is the nearsighted eye, as we already discussed. The light bends too soon. The glasses push the light back. For a farsighted individual, they have shorter eyes. So the light goes past the back of their eye. So the refracting surface of the glasses or the contacts brings that light to the retina, the same way it does for the myopic eye, but it pushes it forward. So you're probably a farsighted individual. You see well far away, but then, as I said, I'm not saying you have problems seeing close now.
I mean, you might be trying to make me wear some glasses, and I'm not ready for it. And so as I no, but this is good. I mean, I didn't realize this, and so now I feel like I need to go and get an exam done so I can find out if I am nearsighted or farsighted, right?
And well, you know, and then you get to cheat because you have your loops, right? You have
right.
your
I cheat. Yeah, I have my loops, right?
But you would notice something like that as you continue to have birthdays if there's a prescription that you've been masking. But it's good for young kids to get it done because children's eyes, they can focus in and out. But you don't know if they're straining, if they're getting undue headaches because they're not letting, the glasses do the work and they're just really trying to focus on objects and their eyes don't have the capacity to focus on those different objects. So that's the first thing, and that's the most basic bread and butter, does the person need contacts or glasses, But the other reason why somebody would go to an eye exam is to check the health of the eye, to check if you have glaucoma, to check if you have older people cataracts, normal aging changes, to check if you have anything going on with your retina, which is the wallpaper of your eye, to check all of those different things. Those are reasons to go. Another reason would be sometimes people are complaining of blurry vision and they don't know that maybe they have diabetes, and we can look and check in the back of their eyes and see if we see signs of diabetes, see if we see signs of other things. I even had a friend of a friend come into my office. He was complaining of an eye pain. He said something was scratching his eye. When we did the exam, he was actually totally blurry in one eye. And the end result of that exam, long story short, was that I sent him to a specialist because we couldn't correct his vision with glasses or contacts, but everything appeared to be normal. What he had was beginning MS.
Oh, wow. Wow.
So he complained of eye pain because something was scratching his eye. And sure enough, when we flipped his lid, he did have something up underneath his eye or up underneath his eyelid. He had a sty. It was, it was inner, but that wasn't really, he was complaining, oh, my eye hurts. And I'm like, okay, yeah, your eye hurts, but you can't see out of that eye. So now we got a bigger problem. I'm like, has this been like this your whole life? And, we basically had to go back through the medical history. We had to figure things out. And the end result was that he was admitted for multiple sclerosis. And so that is something, that's something that if you weren't going for a routine eye exam, if you're not on the radar of getting your eyes checked, that you might miss. And then some people will have retinal damage. Like, again, as I've said, not to keep repeating myself, but you might have holes or tears in your retina that wouldn't have been able to be seen if you didn't get dilated or if you didn't have the eye exam. So,
wow. And I think for me, this has been blowing my mind away. So thank you for continuing to educate me. And I also think that it's important for us to know that you guys have to get these eyes checked. And she's going to talk a little bit more about what's the difference and who should be checking your eyes. So before we get into that, this portion of the show is sponsored by The Sphere. Are you starting your business and looking for a place to advertise? Do you need to reach thousands of people across the world to build your brand or sell your product? If so, get that product placement and advertising needs handled right here at The Sphere. We offer a wide variety of content delivery platforms, including iTunes, Google Play, SoundCloud, YouTube, and Stitcher. Plus, we have a vast demographic reach within the United States as well as most modern countries across the globe. Our enriched content and inspiring dialogue, coupled with our strategic ad is surely to hit the mark every time. Call us today at 832-772-7789 or send us an email at advertise@thesphere.tv. Clearly, I want iTunes to be in town today, so I don't know what that's about. But anyways, let's get back into. So now you've talked to us about why it's so important to go get that eye exam done. But what is the difference between the optometrist, the ophthalmologist, and the opticians? Or does it matter who we see?
That's a great question. And we get that one a lot because, there's so many different O's involved. But
they're definitely tongue twisters. I'm like over here like ophthalmologist, optometrist.
Right.
Yes. So
as I kept trying to respell it, I'm like, am I spelling this right? On a regular basis. But anyway, no, optometrists are primary care practitioners of the eye. So the way I look at it is that, you go there for your routine exams, and then if there's anything going on, if it requires surgical intervention or instrumentation that you don't have in your office, you would refer to a specialist, much like if you go to your PCP and they determine that there's something going on with your heart, they would then refer you to a cardiologist. So I think when I think about optometrists, I think about primary care practitioners for the eye. We treat eye diseases, and we also treat systemic diseases with ocular manifestations that don't require surgical intervention. So pretty much everything, but surgery is our scope of practice. Different optometrists practice differently, and that's obviously based on their setting. So there's certain tests and things that I can do that my license covers, but I may not do it if my office doesn't have the instrumentation or the traffic to support that type of practice. So there are several optometrists that treat, all eye diseases that don't require surgical intervention. You may or may not be, you may go into your local Walmart and they don't have a certain particular instrument. And so that person may say, well, let me refer you to a specialist, or let me refer you, and they might refer you to another optometrist that does have the instrumentation, or they may refer you to an ophthalmologist, if they think that it may result in you needing surgical intervention. Optometrists go to a 4-year program, optometry school, and then they can do a residency, which is optional if they choose to. And as I said before, I did an ocular disease residency, but you're still able to practice without doing. It's kind of like pharmacy. The residency is optional. Ophthalmologists, they go to medical school, and then they do a 1-year, and then they do a residency. A lot of times their residency involves surgery, depending on which specialty they pick. So they may pick retina, the wallpaper of the eye, which we talked about. They may pick glaucoma, where they check and see if there's damage to the optic nerve. They may pick anterior segment, which would be the front surface of the eye, the cornea, or cataract surgery. So a lot of times they have a surgical component. Now there are some ophthalmologists that don't perform surgeries, but most of them do because that's just how the profession is set up. But a lot of times we should be working together, and a lot of times we do. There's typically, there can be really good relationships between ophthalmologists and optometrists. But there was one patient that I had scheduled this week that an older lady told her, you need to go to an ophthalmologist because they check for this. But the thing was, which ophthalmologist? Because they asked me for a recommendation. And I said, well, do you need a retina specialist, a cataract specialist, an anterior segment specialist? So my thought is, if you start with your primary care, which would be the optometrist, if you do need that additional testing, they can refer you to a specialist.
Gotcha.
And then opticians are a technical position. In some states they're licensed, you can be both licensed or unlicensed. Different states have different laws, so I'm not exactly sure what Texas is, but here there has to be a licensed optician on property for people to dispense glasses. Opticians take measurements for eyewear, glasses, and contacts. It depends on what level they get trained for, but they're trained to do different things. Essentially, it's a technical position, and they make glasses and they dispense glasses or eyewear.
Got you. So let's say, for instance, you're at school and your child gets some sort of injury to the eye. Who do you want them to go to immediately? Like if, they're playing on the playground and somebody accidentally nicks them in the eye, where should we go pertaining to eyes immediately?
Well, I mean, of course, I'm going to be biased, but I would say if you would go to the primary care, just like if you wouldn't go to urgent care. You wouldn't go somewhere that doesn't have eye equipment.
Okay.
You would go somewhere that has eye equipment. And then a lot of times, or as I've already stated, if it requires, it may be the child may just have a cornea abrasion, which an optometrist would treat.
Right.
If the child has something more, or more damage to the eye that they think or feel requires surgical intervention or additional testing, then that could be referred out to a specialist.
And I think that's good to know. What about after hours? Let's say, for instance, because you work in a retail center where therefore the office closed at a certain time. Do you recommend that people go to urgent care, or do you recommend that they wait the next day to get treated by the optometrist?
Now, that's a tough question, and I think it also depends on where you are. So most doctors' offices, dentists, everywhere, what do we all have on our voicemail in case there's an emergency?
Call 911. Do not call me after hours because I'm in the bed at 10 o'clock.
And not to get too technical, but there are definitely optometrists that you can see after hours because certain offices will require you to keep, your availability open if you're billing for certain insurances, which once again is very technical. But after hours, there are ophthalmology practices and optometry practices that do provide emergency services. So I guess it just depends really on your state. But if something happens in the middle of the night, you know where to go. You know who to call.
Awesome. Yeah. Don't call us. Call the emergency care. No. So let's talk a little bit. Right. Don't call me.
But you should also follow up. You should also follow up with an eye care specialist if at the emergency room nobody sits you behind an eye slit lamp. This is what we call these instruments back here. This is a slit lamp.
Okay.
You say something's going on with your eye and nobody sits you behind one of these, then you should probably you should probably go somewhere where they can actually look at your eyeball. And so that would be my recommendation on that.
Okay, cool. So now let's talk a little bit about what's going on in our generation heavily. You had mentioned a couple of things that you wanted to discuss that are pertaining to people in this time and age right now. So talk about generational things and what are happening with the younger generation versus the older generation. I know that with older people, we'll talk about glaucoma or cataracts, but for the younger generation, what are some of those things that are impacting the youth right now pertaining to eyes?
Interesting that you said that you split the generations, because I was actually just reading an article today about pertaining to this particular issue that I wanted to bring up. Something that is affecting our generation that did not initially affect younger people is something called dry eye. So dry eye can present itself in a lot of different forms. But now, whereas it used to be something that was for older people or older women in menopause, now it's become what they call a multi-generational condition. And what's going on is that we're experiencing more dry eyes because we are looking and using devices more. So parents will say, I should tell them to stop using their games, or I should tell them to get off their phone. Parents will say stuff like that. And to that I say, no, that's not causing them to need glasses. But what it is doing, or what we are noting, is that it is causing younger people to have drier eyes.
Oh, wow.
And the reason is, if you'll put up, or part of the reason, if you don't mind putting up slide number 6.
Well,
part of the reason.
Before we get into like this picture, let me do this ad and then we're going to go ahead and get into that picture because I want to hear more about that. So this portion of the show is sponsored by KOG and Company. Are your unique gifts and talents changing the world? Unleash Your Dopeness is a people empowerment movement built to encourage the masses and to operate outside of the fears and the gall to recklessly pursue their dreams and passions in life. Join thousands of others as we unlock the greatness that dwells inside. Shop dope gear at KOGpassions.com. That's KOGpassions.com, and use the coupon code DOPE for 10% off your exclusive Unleashed Dope apparel. Act now, sizes are selling out fast. So I know you were just about to get into this ocular dryness, or what was the correct terminology that you said for it?
Dry eye.
Dry eye.
Right. Okay, so a multi-generational condition. So essentially, if you look at this slide here, and I'm going to pull it up on my computer so I can kind of point to it even though nobody can see me. Those things on the bottom slide, that are highlighted, they look like little trees, look like little branches. Those are what we call meibomian glands. Our tear film is made up of 3 things. It's made up of water, mucus, and oil. Oil is secreted from my meibomian glands, and it goes right into our tear film. And that oil helps the tear stay on our eyes longer. But as we're noting, people are not blinking, so they're not the meibomian glands are not functioning the way that they once did. They're not secreting that oil.
Oh,
When we look at
wow.
things, we just stare, and there's our blink rate has changed, and so that muscle or that gland isn't working the way it used to secrete that oil onto the tears to keep the tears on our eyes longer. One thing
Wow.
people will say is, "Oh, I can't have dry eye because I tear all the time." Well, part of that is that the tears are going away; they're evaporating from the surface of your eye quicker, and so your eyes say, "Make more tears, make more, make more, make more," and so you're tearing as a reaction to your eyes actually being dry. So this is something that we're seeing whereas we used to see the top picture where you can see that some of the little trees have kind of died off or they're not
Uh-huh.
working the same. You would see that in older people or older women, and then you would see that inflammatory reaction where their eyes are red or bloodshot, or or like I said, they tear all the time. Think now you're seeing that in people much younger, and so some of the things that we can do to this is, because we can't stop using our devices. Our world exists on our devices, right?
Right, right.
What we have to do are different. They have different treatments. They have heat therapy that they do that help the meibomian glands work better. We also can do, that's a little bit more extreme, but the easier things that we can do are lid hygienes, using lid scrubs or OcuSoft lid scrubs to clean off our eyelids and clean off our eyelashes to
Okay.
just basically make the eye feel better and not have that inflammatory product fall into the eye and cause tearing. We can also use warm compresses, which is the beginning of a quote unquote heat therapy. And the warm compresses make the meibomian glands function better.
Okay.
They help to make the oil secrete right into the tear films better, kind of melt down what may be caked up or kind of go, not working or not functioning as well. And so those warm compresses are something that we do heavily recommend, as well as the lid hygiene, keeping the lids clean and keeping them comfortable, to help the tear film or the stability of the tear film to avoid that dry eye. But that's definitely something that's affecting all generations, but that's something that we're seeing in younger people that we didn't see before.
So let me ask you this question. When I see kids at a restaurant and they're like, the infant is sitting at the table staring at like an iPad, for instance, is that something that people should try to shy away from so early on? Or because I mean, that seems to be like, that's going to
Part
manifest
of the
itself.
issue,
Yeah,
right?
part of the issue. Is that something that we should just kind of stop doing as much? You said that, I mean, yes, we are a society now where digital technology is in front of us all the time. But, is there some regulation, like a certain amount of hours that we should be spending in front of a device versus not? And how young should we be spending in front of the device?
I think if I tried to sit up here and say, that nobody should use devices, I think that's unrealistic, because
Right.
the kids are asking for the devices.
Right.
I do think we should, monitor our use of devices, but I also think that there are things in glasses, and built into our devices, like blue light filters that can help cut some of that, cut some of the reflections of the glare from the different devices that would help, make the eye more comfortable. But the blink rate, you do want to be aware of, taking breaks and blinking and not staring at stuff without, ever blinking your eyes or making any kind of eye movements. And then again, like I said, some of the therapies of the warm compresses and lid hygiene, making sure that you're diligent about keeping your lids clean. I think that will help with the dry eye epidemic that's kind of going on. Epidemic is a strong
Is
word,
dry
but
eye is dry eye reversible? Are
it's
those glands
reversible. But
will they come back? Those glands will they come back?
no, the glands will not come back. So that's why you kind of want to be diligent about not, when they fall out and they're completely gone, they're not going to come back. But there are things that they, in between the picture on the bottom and the picture on the top, where you can be using warm compresses to basically, keep that gland functioning the way it's supposed to. You can blink more. You can use lubricative therapies to keep your eyes, moist, to basically make the eye act as it's supposed to act.
So yeah, I'm gonna be blinking for the rest of this show now because I'm trying to make sure. As soon as you start
That you're
saying
not
blink, I'm
caught
like,
staring.
I'm ready for it.
Blink,
So.
blink. Well, which is funny, because when we're doing our exams, a lot of times you'll tell a patient to blink and they're like, "Oh, my vision got better." And I'm like, "Yeah, blink normally." And people don't know what that means anymore,
Yeah,
because
now
we
I'm
used
just
to
like, I
say,
gotta keep blinking because I want to
just
make sure.
stare, yeah. That
So
is working.
so then let's talk a little bit about glaucoma and cataracts, because that is something that we do know the older generation has, and I want to know the difference between them. What is glaucoma and what is a cataract, and then what
Okay.
should we do to treat those?
Okay, let's yeah, I think it's always interesting because when we listen to a lot of music and people are saying, "Do I got cataracts? I should smoke," and things like that. All wrong, not right.
What do you
That's
mean?
so,
That doesn't get rid of the cataracts? I thought
no,
that
it
released the
doesn't.
pressure and all this
Well,
other stuff,
right,
right?
exactly. So I love that you did that because you literally just did exactly what everybody does, and they mixed up the two things, and we're now having a conversation about two different
You're
things,
like,
but under
what?
the
What is
same thing.
that?
Right. So if we can pull up slide number 5, we'll kind of go through what glaucoma is. Glaucoma is actually not unique for just older generation, although it can be a slower process, and so there you do often catch it, when people are older because it's a slower process. It doesn't happen all at once, but it's not something that's only for old people. What glaucoma is, by definition, is damage to the optic nerve. The optic nerve is the part of your eyeball that basically connects your eye with your brain. So you see with your eyes, but you also see with your brain. The optic nerve is that cord that takes the signal to your brain so that you can see.
Okay.
And glaucoma is damage to that nerve. What can cause damage to that nerve is high eye pressures. That's one of the more common things, and that can cause damage to that nerve. So that's what we'll speak on. So with the high eye pressures, they can manipulate the pressures in the eye to basically lower the pressure so that you take the pressure off of that nerve and you don't get that damage. So you can see what the picture has labeled as a normal optic nerve head, and then you can see where the one next to it is a lot larger, and that is because probably high pressures in the eye have caused that nerve fiber layer to die, and so that's where you see that it's died off. Now when the nerve fiber layer dies, what it does is it takes your peripheral vision, your side vision,
Oh,
first.
okay.
And then if it gets, extreme enough, it can cause, complete blindness in that eye if there's enough damage to that nerve fiber layer. Because now, if the nerve fiber layer is damaged, that optic nerve is not working. It's not taking that signal to the brain, and so therefore you will lose vision in that eye. And so what you can do for glaucoma is you can manipulate the pressures. So that's part of going back to getting a routine eye exam. You could be
Right.
25 years old and go, and we notice that you have large optic nerves. And so we say, hey, is this just the way you were born? Is this physiological, or has there been pressure on that nerve that's caused damage? And that's where we would send you to get additional testing done to see if the nerve fiber layer has been damaged. And that would
Right.
be like a visual field test, or basically a scan of the optic nerve to see how much, nerve fiber layer is there. And that could be a 25-year-old, that could be, a child, that could, but a lot of times it is an older folks. And so at that point, whenever they do determine that there may have been some damage to the nerve, they would treat you often with drops, or there are different types of surgeries that they can do to lower the pressures in the eyes without getting, going off on a tangent. You manipulate the pressure, you take the pressure off of that optic nerve, and a lot of times you cannot get back what you lost if you lose peripheral vision, but you can stop it where it's at.
Okay.
So that's
Okay.
glaucoma. Now, the reason why people say you smoke when you have glaucoma is because it smoking marijuana has shown that it can lower your eye pressures, but you would literally have to smoke all day to keep your pressures low enough to
I
not
think
cause
that some
damage.
people probably have no problem with that, but
Well, you understand,
unfortunately.
right? So that's glaucoma. Now, cataracts, if you go to slide number 4, cataracts are a normal aging change. People who have birthdays will get cataracts.
Okay.
And what it is it's a cloudiness of the lens. Now, I know you guys don't know what normal lenses look like, but let's say this. Behind that color part of the eye when you're born is a lens. And that lens is like a clear M&M. So if you can imagine a clear M&M sitting behind that colored part of the eye.
Uh-huh.
Now, this is a dilated pupil, right? This is a pupil that's larger. And so if you can just imagine a clear M&M sitting there, as you get older, as you have more birthdays, that lens or that clear M&M starts to get cloudy.
Got you.
And so when the light goes into your eye, it scatters on that cloudiness. It scatters on all those little things in there, and it makes the images blurry. It makes it difficult for you to see. So what they do is they essentially take out that cloudy lens, and they insert a fake lens and and then you're able to see well. And a lot of times people don't they don't end up needing glasses or contacts afterwards, or maybe they just use them for reading. But that's not, that's not a guarantee. But cataracts are normal aging changes. People who have birthdays get cataracts.
So is that where when you look at people and their eyes look a little bluer? Because I'll notice as we get older, like people who had regular brown eyes, now they look like their eyes are starting to turn more blue.
Interesting. So what causes, I think, that blue tinge is actually something called arcus. The body deposits cholesterol in the eye. So what people are seeing is that ring around the eye. I'm pointing at my computer like y'all can see what I'm doing.
No, but we got it. So we got the picture back up. So with the cataract up, okay.
So you're talking about something different. You're not talking about the cataract. We're talking about a ring that starts to look blue that actually goes around the edge of the color. So closer to the white part of the eye. That's actually cholesterol, and we call it arcus.
Okay.
Yeah, so the body just deposits cholesterol there. So that has nothing to do with cataracts or anything.
Okay, I thought that was a cataract when I'm looking at that. Wow, I didn't know that. Okay.
Right, no. You would have to look through the pupil, and sometimes you can tell if somebody has a really, really dense cataract, then yeah, when you're looking through the pupil, you'll see the cataract. But that's not something that you want to see. You want to walk up on somebody in the street and be like, yo, you got a cataract? Like, nah, I wouldn't. It wouldn't be that apparent because you would have to have a dilated pupil to be able to see that.
Wow.
Right.
Oh my God. You have truly educated me so much. I know that our viewers have definitely got educated as well. So one last question. How often, I wish you were here in Houston, but since you're not, how often should I go get my eyes checked? Is that a yearly thing? Is that every 6 months?
It's a yearly thing. It's a yearly thing, and I never got to talk about dilation, so I'll put it in a phrase that you would understand too. When you go for your routine exam, I think you should get dilated, if not every year, every other year, because to me it's like going to the dentist and not getting your teeth cleaned. Like, why'd you come? Like, you want to get the health check, you want to get the health assessment, you want to make sure that the back of your eyes look good. So I do recommend yearly eye exams. And I do recommend regular dilation because it lets us see things like glaucoma, and it lets us see things like retinal damage. It lets us see diabetic changes. Our diabetics should be getting dilated every year, if not every 6 months or 3 months, depending on how severe their diabetes is. And just for fun, show slide 3. I know you got to get out of here, but I just want to scare people a little bit. Slide number 3 shows what diabetic retinopathy looks like. And that's why diabetes is, one of the leading causes of preventable blindness in this country, is because diabetes causes bleeding in the back of the eye and it disrupts the function of the eye. And so getting dilated lets us see, if as a diabetic, if you have beginning blood spots and if there's somewhere that needs to be laser before you get to something extreme like the picture is showing, if y'all can see that. But
yeah. So
yearly
if you're dilated, is there an age that we're getting dilated to?
I recommend that everyone be dilated regularly.
Okay. So there's no, like at 10 years old, we should be dilated. Getting dilated.
Yeah, you can get dilated at any age, and I do recommend it. And then if you don't get it every year, because not every doctor does it every year, I don't do it every single year on every patient, even though it is recommended, and some people might be mad at me for it. If you're not going to do it every year, I don't want them drops, you can do it every other year, but routine dilation is recommended.
Well, I, like I said, have been blown away by so much knowledge today. And Dr. Ngoddy, I know that you are having to get out of here because we want to get you safely home in this Atlanta snow weather. I know y'all Atlanta people don't know how to drive when the snow comes. The highway shut down.
Why are you not on your way home? So I got to get out of here. I do need to get out of here. But this was fun, and I really appreciate you including me.
Well, I am so grateful for you reaching back out to me. Thank you so much. And then what I want to do is one more time, just for people who are interested in trying to get to you specifically, where can we find you? And then on social media, where can we find you as well?
Okay. So I am located in Morrow, Georgia, at 7325 Jonesboro Road in Morrow, Georgia. The phone number for the Sam's Club location is 770-960-1604. I'm also located in the Walmart off of Cleveland Avenue at 844 Cleveland Avenue Southwest in East Point. And the phone number there is 404-460-6163. And you can follow me on Instagram at iServeATL. EYESERVEATL.
Well, I am
All
so
right.
excited to thank you again for being on here. I have learned a lot,
You're
and I know
welcome.
our
Thank you
viewers
for
have
having
as
me.
well. And of course, guys, this is Doc. So I am Dr. Simone Ellis, and you can find me at Smile Design Studios, located in Missouri City, Texas. And again, my co-host will be back next week. I'm excited to have her back on the show as well. So guys, please make sure you're checking us out. Share this information with your friends and family, and be sure to follow us on all our social platforms. It's been wonderful having you guys here, and have a great afternoon. Take care.